going to be talking a little bit about polio. What is polio? It is an infectious viral disease that affects the central nervous system and can cause temporary and permanent paralysis. Paralysis, temporary or permanent, defines the disease. Polio is caused by one of three types of poliovirus, which are members of the enterovirus genus. Now we're going to be showing you a little video about polio.
The truth, more frightening than a lie, disturbing than a dream. It's all we survive in crime. Those with the courage to say, call them a witch and burn down another state. So traded the youth for a dream, and the best years around for a crown of thorns, as it turned out. So is the truth, more frightening than a lie, so afraid to die without an explanation. Those with the courage to say, call them a witch and burn down another state.
So I'm going to talk a little bit about the history of polio. So polio reached epidemic proportions in the early 1900s. The last case in the United States wasn't until 1979. It occurred in countries with high standards of living. Scientists think that advances in hygiene paradoxically led to an increased incidence of polio. A common theory is that infants used to be exposed early on to poliovirus in contaminated water, and they were able to fight it off because they were getting their mom's antibodies still. Because of better sanitary conditions, exposure is now delayed later to life, and children are no longer able to fight off the disease. So this is just a picture of a polio ward back in the 1900s. Tens of thousands of Americans in the first half of the 20th century were stricken by polio. So this is just a polio ward showing the amount of people that were affected by the disease, and they're in these iron chests that they use to support their respiratory system because they were paralyzed.
Incidence of polio. Polio cases have decreased by over 99% since 1988, from an estimated of 350,000 cases, then to 359 reported cases in 2014. Today, only 2 countries, Afghanistan and Pakistan, remain polio endemic. It is estimated that global polio eradication will occur within this decade. Polio mainly affects children under 5 years age.
So I'm going to talk a little bit about transmission. Polio is spread through contact between the nasal and oral secretions and by contact with contaminated feces. It enters the body through the mouth, and it multiplies along the way throughout the digestive tract. It also gets into the blood and spreads to the lymphatic and CNS systems. Also, it is virally spread along the nerve fibers. Some clinical manifestations include paralysis. Up to 72% of polio people are asymptomatic, and it's excreted through their feces. So if they don't have any signs or symptoms, the only way they would tell they had polio is through their feces. Fever, fatigue, headache, vomiting, and stiffness or pain in the neck are often common signs. And paralytic symptoms generally begin within the first couple weeks, and then the paralysis can progress within 2 to 3 days So it really escalates pretty quickly.
So there is no cure for polio, but as the video in the beginning made note of, it's important to vaccinate your child. So there's two types of the vaccine. One is called the inactivated poliovirus vaccine, or IPV, and that's injected in the leg or the arm. And then there's also the oral poliovirus vaccine, and these vaccines are given multiple times to protect a child for life. And most people recommend that the people are to be vaccinated as children. And there is a schedule for when to vaccinate your child. Typically, you get 4 doses of the IPV or OPV at 2 months, 4 months, 6 to 18 months, and then you get a booster at 4 to 6 years old.
Now, the prognosis for polio. Among the individuals becoming paralyzed by polio, 5 to 10% die when their breathing muscles become immobilized. Fewer than 25% of people with polio are disabled for life. After 15 to 40 years from recovering, 25 to 40% of people experience new muscle pain and exacerbation of existing weakness or paralysis. This is referred to as post-polio syndrome. Now, for the treatment of polio, primary treatment is prevention by getting the vaccine. Some nursing interventions include bed rest, pain relievers, and anti-inflammatory medications. Also, we now have portable ventilators that may be necessary when the respiratory system becomes paralyzed. And as before Emily explained, they used to use like the iron lung chambers, which helped pull air in and out of the lungs. And we also can also use moderate exercise or physical therapy to prevent deformity and loss of muscle function. And also, you should include a dietitian. That's it.